Hello, good morning students. Today we'll study hemostasis. Hemostasis is blood clotting, that is when there is a cut, bleeding is there, how this bleeding is controlled with the help of the platelets. Hemostasis. A break in blood vessels stimulates hemostasis, a fast localized response to reduce blood loss through clotting. Vascular spasms are the immediate vasoconstriction response to blood vessel injury. Platelet plug formation. When endothelium is damaged, platelets quickly stick and spiky, adhering to each other and the damaged blood vessel wall. Once attached, other platelets are attracted to the site of injury, activating a positive feedback loop for the clot formation. Coagulation or blood clotting. It is a multi-step process in which blood is transformed into liquid to a gel. Factors that promote clotting are known as clotting factors or procoagulants. Those that inhibits clot formation are known as anticoagulants. The clotting process involves formation of prothrombin activator, conversion of prothrombin to thrombin, and formation of fibrin mesh from fibrinogen in the plasma. So the blood clotting, three stages they are there. In the first stage, the platelets attack to the endothelium, that is the blood vessel wall which is damaged. Second, platelets start to release fibrin and begin to seal the endothelium. And third, the fibrin network traps the RBC and completely seals the endothelium. So in this way, clot formation is there. So after the clot formation, there is a clot retraction and repair. Clot retraction is a process in which contractile proteins within the platelets contract and pull on neighboring fibrin strands, squeezing plasma from the clot and pulling damaged tissue edges together. Repair is stimulated by platelet derived growth factor, that is PDGF. Then there is a process of fibrinolysis, that is, it removes unneeded clot through the action of fibrin digestive enzyme, that is plasmin. Growth limiting clot factor formation. Rapidly moving blood disseminates clotting factors before they can initiate a clotting cascade. Thrombin that is not bound to fibrin is inactivated by antithrombin 3 and protein C as well as heparin. So disorders in the case of hemostasis. Number one is thromboembolic disorder. Such results from conditions that cause undesirable clotting such as roughening of vessel endothelium, slow flowing blood, or blood stasis. Disseminated intravascular coagulation is a situation leading to widespread clotting throughout intact vessels and may occur as a complication of pregnancy, septicemia, or incompatible blood transfusion. Bleeding disorders arise from abnormalities that prevent normal clot formation, such as deficiency in the circulating platelets, lack of synthesis of procoagulants, or hemophilia can be A, hemophilia B, can be hemophilia C. Secondary hemostasis. Platelets alone are not enough to secure the damage in the blood vessel. A clot must form at the site of the injury. The formation of clot depends upon several substances called the clotting factors. These factors are designated by Roman numbers 1 to 13. These factors activate each other in what is known as the clotting cascade. The end result of this cascade is that fibrinogen, a soluble plasma protein, is cleaved into fibrin and insoluble plasma protein. The fibrin protect stick together proteins stick together forming a. Now these are the 13 factors which are responsible for the formation of the blood clotting. So we are going to learn each and every factor by its name. That is, factor 1 is fibrinogen. It is synthesized by the liver and it is responsible for the common pathway. Factor 2, that is prothrombin. It is also synthesized by the liver and it requires vitamin K also for its formation, and it is for the common pathway. Then factor 3, that is tissue factor or tissue thromboplastin. It is a glycoprotein in the plasma membrane of cell underneath the endothelium, and it is responsible for the activation of extrinsic pathway. Factor 4, that is calcium. It is inorganic ion present in the plasma acquired from either the diet or from the bones. It is needed for all stages of coagulation process. Factor 5, it is known as proacceleratin or labile factor or platelet accelerator. It is a plasma protein which is synthesized by the liver and it is responsible for the common pathway. Factor 6, number no longer is used in the blood clotting factors. Number 7, that is proconvertin or convertin, plasma protein synthesized by the liver, and it is used in both extrinsic and intrinsic mechanism. Factor 8, also known as antihemophilic factor, and it is synthesized in the liver and its deficiency causes hemophilia A, and it is involved in the intrinsic mechanism. Next is plasma thromboplastin component, that is PTC or Christmas factor. It is a plasma protein which is synthesized by the liver and its deficiency causes hemophilia B, and it is involved in the intrinsic mechanism. Then factor 10, Stewart factor or Stewart-Powell factor or thrombokinase. It is also a plasma protein synthesized in the liver and it is involved in the common pathway. Then factor 11, plasma thromboplastin antecedent. It is a plasma protein synthesized in the liver and its deficiency causes hemophilia C, and it is involved in the intrinsic mechanism. Next is the 12th factor, that is the Hagman factor or glass factor. It is also a plasma protein synthesized in the liver, activated by negatively charged surfaces, and it is involved in the intrinsic factor. Then last is the 13th factor, that is fibrin stabilizing factor. It is also a plasma protein synthesized in the liver and bone marrow, and it is involved in the conversion of fibrin to polymer for the formation of the clot. So these are the 13 factor. Out of these 13 factor, factor number 6 no longer is used. Then there is a calcium factor, factor 4, and there is a tissue factor, which is factor 3, which is present underneath the endothelium. Rest all the factors, they are synthesized by the liver. So in this way we can study the cascade of blood clotting, that is, there is a extrinsic pathway and intrinsic pathway, and then there is a common pathway. So here in this figure you can well see, we'll start with the intrinsic pathway. Activators, they are collagen, glass or other. What they'll do, they'll activate the factor 12. The activated factor 12 will activate the factor 11. The activated factor 11 will activate the 9 factor. The activated 9 factor will convert the factor 10 to activated factor 10 under the presence of factor 8, calcium and phospholipid. Then factor 10 activated will convert prothrombin to thrombin in the presence of factor 5, calcium and phospholipid. Then this thrombin converts fibrinogen to fibrin, and fibrin under the influence of factor 13 is converted into fibrin polymer. Now we'll start with the extrinsic pathway. Extrinsic pathway, here activator is tissue factor. Tissue factor converts 7 inactivated factor to 7 activated factor, and this 7 factor, it under the influence of Tissue factor calcium phospholipid converts 10th factor into activated 10th factor, and then the process it goes. That is why this is known as the common pathway. So in common pathway we have 10th factor, 5th factor, prothrombin, fibrinogen, and factor 13, right? So in this way the blood clotting cascade is there. So this is how the RBCs, they are trapped by the fibrinogen and the polymer of fibrin, and the thrombus formation is there. So for the thrombus formation, first of all the protein adherence is there, then platelet adhesion is there, then cell deposition and fibrin formation is there, and then is the formation of the thrombus. So in this way, one by one the hemostasis is done and thrombus formation is there. So we can say that first for the vasoconstriction, and then is the platelet aggregation at the site. These platelets, they will then break down to form the fibrin, and ultimately the blood is stopped by the formation of the clot. So these are the platelets aggregating. So thank you www.google.com for providing us beautiful pics so that we can explain our topic. Thank you.